It's 6 o'clock on Friday, the 23rd of October. Good morning. This is Today with Nick Robinson and Sarah Smith.
Okay. Well, look, at 17 minutes to 9, that gives us a little longer than we were expecting, but that's a good thing, to try and deal with your questions. In recent days, we've been asking you to submit your questions about COVID-19, and we'll try to answer them, not Sarah and me, but the experts, of course, about the risks, the rules, the latest science, and what to expect this winter.
And those experts waiting to answer the questions are Dame Clare Gerada, who is the former chair of the Royal College of GPs, and also Tom Solomon, who is director of the UK's Emerging Infections Unit at Liverpool University. And the first question that we have is from Tessa Fryer. She says, I live in a Tier 1 area. Can I visit a terminally ill close relative in Tier 3? And if yes, what precautions should I take both there and when I return home? Dame Clare Gerada, can you answer that one for us?
Well, good morning. And what a time that we've come to, that we've got to consult with the lawyers before we do something as humane as see somebody who's dying. I suspect, and you billed me as an expert, but many people are finding these rules very confusing. My understanding is you take your rule, i.e. if you're in Tier 1, to wherever you are. So I suspect the answer is yes, you can visit a Tier 3. But before anybody challenges me, the rules are so complex that I would actually want to consult, as I said, the rule book. But what I would like to say is that in the end, this is about two people visiting each other and somebody's dying. And I think, and I'm in this position, I'm visiting someone who's dying on a regular basis. And what we've done is we've talked about it. We've talked about what they want, how I can keep them safe. And yes, I keep a distance, I wear a mask, and I wash my hands before I go into the room. But I don't know whether that's the right thing to do or the wrong thing to do in terms of the new regulations. The regulations changed recently and it's very difficult to keep up. But I think in the end, anybody listening to this will understand that if Tessa wants to go and visit a dying friend, then that surely has to take precedent over everything else.
What's interesting about this is there is a question of judgment, not just regulation and laws each time. Let's turn to a question now from Andrew Dobson, who wrote to today at bbc.co.uk. Tom, perhaps you can answer this one for us. Is there now another risk of a further spike of infections at Christmas when thousands of potentially infected students are released back into the community with the deliberate intention of socially mixing with friends and family? If so, have any specific measures been considered to mitigate this?
Yeah, would you mind if I, just before I answer that one, just briefly come back to the earlier one? It is terribly difficult, and I know there are all sorts of moral dilemmas, but I think actually the answer is that the person, if they're going to follow the rules, they shouldn't visit that somebody in a Tier 3 setting, in the sense that someone who lives in Tier 3, the terminally ill person, should only meet socially with friends and families who are part of their support bubble and their household. So, but they could meet in an outdoor space, so that if this person who is ill could get to a park up the road, then you would be able to visit them without breaking any rules. But clearly, I think other things are going to also be important to people.
So then turning back to Christmas, Tom, and this question about whether, in a way, I was putting that point to the Minister earlier on, and indeed to the Shadow Chancellor, about whether we can look forward to anything like a normal Christmas. Given that many students will be coming home, do we need to make special provision for that?
Well, we do, and there's lots of discussion about how this might be done, what the different ways are. People are thinking about making students isolate for 2 weeks before they go home. Many of them are doing online learning now anyway, rather than mixing in lecture theatres. So it might be that we say to all students, spend 2 weeks in isolation before you come home. There's also talk of testing all students before they come home. So I don't think anything is fixed yet. And it depends a little bit what the situation is across the whole country. If we're all in Tier 3 by then all the students will be isolating anyway. And then also there'll be advice when they go home. So again, if they're going to a place that's in Tier 3, once they get home, the only people they will mix with are their families. Whereas if things have, hopefully the virus will be under control more by then, in which case they will be able to meet others. But it's people are thinking about it. It's a bit early to say what the precise situation will be, I think.
Our next question is from Leslie McIntyre. It could be for Clare or Tom, whoever thinks they're better placed to answer it. The question is, do you foresee a time in the not too distant future when you'd be able to buy a test for yourself and your family so that you could then spend the weekend together? She says she's a self-shielding grandma living on her own who hasn't hugged her grandchildren or anybody else for 11 months. So will it soon be able to buy a test and resolve that situation, Clare?
Isn't that sad? Well, I suspect that Tom is in a better position to answer this, but I suspect we will get the equivalent of, people know of pregnancy tests, instant tests coming round the corner. I imagine that's what many people are beavering away at. Of course, as with the pregnancy test, you can still get false positives and false negatives. And also you have to do it at the right time. But I suspect we will get into a position where you will be able to test yourself and then wait maybe 48 hours to make sure you're just not in that cusp where you're testing negative but still have the infection. So, yes, I suspect we will be able to, but Tom may well be in a better position to answer that.
How soon might that be, Tom?
Well, you can do it at the moment. You can buy private test kits for between £100 and £300, but some of them are not very good. If you buy one, you need to check it's got the CE mark. But as a national policy, there's a drive, and it's been talked about for a while, to have lots more testing available, home testing kits. We're not quite there yet, and I don't know how long it will be. But some test kits now will turn the result round very quickly, but they're not the sort of what we're after. Ideally, is a simple home test kit, like Claire says, which is like a pregnancy test that you can do based on a mouth swab or a nose swab that will give you an answer within an hour or two. But we're not quite there yet.
Well, let's turn from the restrictions to the treatment of people who've got COVID. Ian Ralph has been in touch saying, I'm 77, I've spent 2 months in hospital with COVID, but he goes on to say I've been cared for superbly and I'm doing very well. What he wants to know, Tom, is Claire, what is the latest thinking on reinfection? Am I vulnerable?
So you're asking the GP the infectious disease questions and the infectious disease questions. I will hazard
swap
a guess.
Away.
The evidence so far, I'm going to answer it, then Tom can correct me. I suspect so far that the tea leaves are saying that once you're infected, the chances are that you probably, it's very hard to become reinfected. There are very, very few people across the world who have had a true second infection of COVID. There are reported cases, but people can get chickenpox twice, 3 times. Sometimes people can get chickenpox even more than that. So having it once doesn't guarantee immunity, but I suspect it pushes you much more into the space that you probably are immune. So, but let's see what Tom's going to say.
Go on, Tom. How did she do?
No, Claire is spot on. I give her 10 out of 10. Well, all I'll add is some numbers. There are perhaps a dozen cases suspected, but there's been 4 well-documented cases where somebody has had a second infection, but it's very rare. Most people, it would seem, are protected initially. Now, down the line, of course, in months or years ahead, if this coronavirus behaves like other coronaviruses, you won't be protected forever, and you might be able to get another infection. But usually, a second infection is milder than a first, and you may not even know about it.
So that's very good news, because of course I had COVID very early on. I caught it a gift from New York, and I did get my antibodies checked and had very high levels. So I'm holding on to this belief, Tom, that I've had so many antibodies that actually I'm now immune. But maybe I might.
But we still want people to behave, even if people
of course
think
I'm behaving as if I'm behaving as if I'm not.
We still want people to wash their hands and keep their distance, etc. But the risk, if you think about it, if there's maybe up to 40 cases of a second infection among 40 million people who've been infected, that's about 1 in 10 million, and the risk of dying on the UK roads each week is about 1 in a million. So it's less than that risk. So I think most people don't need to worry about it too much.
Now, Michael Rosen has been in touch. Yes, the writer Michael Rosen, and he asks, why or how does COVID-19 affect the nervous system? Because some people, including him, who've had COVID-19 have had a loss of feeling in fingers and toes and brain fog. Yes. What brings that about, Tom?
Yeah, well, I work on infections and I'm a neurologist, so probably this is one for me to answer. And in fact, it's one of the things we're doing research on. We know that anyone who's been on intensive care, and I think Michael was on intensive care because there was a super piece by Simon Hattonstone in The Guardian where he interviewed him. And we know anyone who's been on intensive care can feel not right for some months afterwards. But COVID-19, the virus does get into the brain. Sometimes it causes things like a stroke or encephalitis, which is a very nasty inflammation and swelling in the brain. But more often, it causes subtle problems, anxiety, delirium, confusion. Now, that usually settles when people leave intensive care. But then we are seeing that people are left with what's being called long COVID, which is a mixture of problems afterwards. And it's been recently divided up into 4. So in some people, it's just the mugginess that people will feel after they've been on intensive care, which gets better usually, though it can take months. Sometimes it's damage to organs from the virus, and sometimes it seems to be a chronic post-viral thing, which we've seen with other viruses. And then the 4th group is just the unknown, because so much about this virus is still unknown. But my message to Michael would be that we would expect it to get better if it's the post-intensive care syndrome. But we have recently been had funding from the UK government for a large study, which is being led by a colleague of mine from Liverpool, where we are looking into this exact problem. So if Michael is interested in being part of that study, he should get in touch.
Just a quick one now on a big controversy. Steve Audle gets in touch and says, according to Carl Hennigan of the Centre for Evidence-Based Medicine, hospital admission rates tend to rise at this time of the year due to a seasonal increase in respiratory and viral infections. Isn't the rise we're seeing now simply what we would expect to see? Tom and then Claire.
I think that's right. I'm sure Claire will tell us that we see increases in all respiratory infections at this time of year. So we would expect to see an increase, which is why we were anxious over the summer about what was going to come in the winter. But the point is that this increase in COVID-19 is similar to increases in all the other respiratory viruses, but COVID-19 is spreading very easily, and it makes so many more people sick because for most people, this is the first time they've met the virus. So it has a higher rate of hospitalisation and deaths overall because so many people are meeting it for the first time.
Claire?
I absolutely agree. And we actually, over the summer and autumn, the beginning of the autumn, saw a decrease in some of the infections that we would normally be seeing, such as the childhood infections of children not washing their hands and spreading diarrhea between each other. So there is a sort of flip to this. But yes, of course, my surgeries at this time of the year, if they were face-to-face, would be full of people with viral infections, with respiratory illnesses. We're seeing increasing numbers presenting to us with upper respiratory infection, not necessarily the flu, that's not hit us yet, thankfully. So please, everybody who's at risk, who's eligible, get your flu vaccine. So there is a certain amount that this is normal for winter, but actually, as Tom says, the reason we're getting sick with this virus is because none of us have ever had it before, and we're all naive to it. So but we are seeing more of it coming up, but I think proportionally more than we would see just if it was the increase because of the winter increase.
Ellie Clark is looking to the future and wondering if we never eliminate COVID, if it becomes endemic instead, what life will look like in years to come. We'll be wearing masks and having to keep our social distance for many years. I'm going to have to ask you both to be brief, I'm afraid. But Claire and Tom.
I'll start then. Well, it is endemic. It's already endemic. We haven't eliminated any virus, as far as I'm aware, other than smallpox. We've not even eliminated polio, even though we've got a very good vaccine for it and have had for 70 years. So it is endemic. God forbid if we're going to have to be wearing masks all the time and social distancing, but I'm sure we'll be playing that out and talking about that in the near future.
Yeah. We won't have to wear masks and do social distancing all the time because as more and more people get infected with this virus, infections will start behaving over time more like the 4 coronaviruses that cause seasonal coughs and colds. So eventually so many people will have met it or will be vaccinated that we will have a degree of herd immunity. And then when people meet it again, they will not have such a severe infection. So ultimately we won't have to do all this social distancing, wearing masks, etc. But we certainly must do it for the time being.
Phew. Tom Solomon, Professor Tom Solomon and Dame Clare Gerada, thanks so much for answering all our listeners' questions.